Welcome back to the Mountain Morning Show. You know that I love the Utah Council for Citizen Diplomacy. I think it is a alternative to so many important things. To so many things. Maybe one of the most important alternatives it is the alternative to war. Often, the diplomacy, the opportunity to talk and discuss and find out that we're more alike than we think we are, is a critical part of our future on this planet. And one of the future really lies within our youth. I'm very happy to have some very important people from all over the world right now here on the program as part of the Utah Council for Citizen Diplomacy, and it is the Young Leaders of America's initiative. And with that, we have Watson Césaire. He is a dentist from Haiti. Next to him, Maribel Alpaz, Portugal, who is a doctor from Bolivia, and then Maria Julia Alvarez, who is a designer from Nicaragua, and then finally with the Utah Council for Citizen Diplomacy, Rochelle Delva, who is a communications associate. Thank you.
Thank you.
I appreciate you all being here.
Thank you for inviting us.
Absolutely. So first of all, I suppose we should start with you, Rochelle. Would you give us a little background on this program, this part of the Utah Council for Citizen Diplomacy?
Right, so this is a program that we have every year, and this year we're fortunate to have a group of international professionals from all over the world, but mostly the Caribbean and Latin America. They are absolutely amazing, very impressive, although they look very young, but all of them are super smart doctors, dentists, and they're trying to do great things in their countries, and so that's what got that's what got them to come to the U.S. and learn and find ways to develop more skills and get more connections, and hopefully go back to their home countries to continue doing great things.
That's
so we're
awesome.
very happy to have them.
Yeah, for sure. Now, how long typically is this association last? How long do they get to come to visit?
They stay for 1 month.
For 1 month?
Yeah, so first they all arrived to the US. They went to Atlanta for I think about 3 days. And after this point, they all go to different cities in the US, and
Wow.
we have 10 here in Salt Lake.
Amazing. There's 10 altogether. Well, we picked 3 that I'm very excited to talk to. Thank you so very much.
Thank
This
you
is
for
awesome. What a
inviting
great
us.
experience. So I guess first and foremost, we'll start down here with Watson. Why are you excited to be part of this? What makes this good for you?
It's because, it's gonna help me to do some new network, so to build my network. So it's a great opportunity for me to learn from other organizations that involved in community health, like me, because I'm a dentist, so I'm part of the community health. So I am here to learn and to share my experience with others. So I think it's a very good opportunity for me to learn from people in the US and to go back in Haiti and to continue my work. So I think it's a very, very, very good and great opportunity.
I've spent quite a bit of time in Haiti, and I'm kind of curious now. It's been a long time since I've been there. What is dentistry like in Haiti right now, if you were to compare it to, say, the United States?
Oh, I think there's a big difference between Haiti and the United States. In Haiti, we don't have the latest technology as you have it in the US. So that's, I think it's a very, very big difference. So in Haiti, dentists, maybe it's pretty like the US, because dentists used to stay in the cities, in the big cities. It's the same thing in Haiti. That's for this reason, so I create my project, because I moved to the countryside. So in countryside, you won't find any dentists, because all you want to do is to make money. So
yeah, and there's not a lot of business out there, right?
Yeah, right.
But a lot of need.
A lot of need. So.
And I suppose, just like us, I mean, you find people whose health is compromised by their dental care.
Yes.
So
yes.
pretty critical that you get out there.
Pretty critical, because one of the biggest problem is the lower education. So people don't get educated, and then you need to do that. So every day, so every time, and so that's one of the biggest problem in Haiti now, because if people don't get educated, so they don't they won't know what to do.
Right.
So,
It's not even on their. It's not even in their thinking because they're
Yes.
not. They're not thinking from a point of health, from the education side of it, from knowing.
yes.
Very important. Maribel, I presume that this is not much different when it comes to doctors from where you come. Tell us a little bit about that experience and why this is, what you hope to have changed by this experience.
Okay, in my case, it's a big opportunity because I work with terminal ill people. So in my country, there is no a place for them. In my country, there is no a hospice. So this opportunity that Meridian gave me is to know how these places work. I was looking for a place for I can get some information from the internet, but it's really different when you go to the place and when you live the experience. So this for me, this changed my point of view, opened my mind, and give me this big opportunity to live. And when I come back to my country, I'm going to share this with my community, and we are going to have a lot of work, but we are going to know every step that we have to follow for open a hospice in my country.
Finally start having some senior care facilities there. That'll be interesting.
Yeah.
Family is very important in Bolivia, right?
Yeah.
And so typically care is done within the family, I'm assuming, at the home. Is that really where we
yes.
see that when seniors are getting ready to make a transition?
Yes, but we have a big problem in my country that in the last years, a lot of people are abandoning the hospitals. No, when I work, when I saw these cases, and we looked for a place for them, but we couldn't find a place for them. So every single person in the world needs to have their last days with dignity, right?
Couldn't agree more.
Yeah, and our goal is work for them and give their last days with dignity.
That's amazing. It's so important, that work.
Yes.
And not to say that it's not important to look good and feel good at the same time, Maria. Right?
I'm going to change that perception.
Yeah, it's important. Tell us a little bit about your experience so far, what you plan to take home.
Okay, well, I am a fashion designer, as I told you, but my project goes beyond there. I have a fashion, like a fashion label, a fashion brand in my country. It's there's not many in my country because we don't have the technical workforce to produce in Nicaragua our clothes. So the project that I'm working currently on is a sewing school and to set up a factory.
Wow.
To do both things. First is to reduce the unemployment rate in Nicaragua for poor communities, people that don't have much education and don't really have the opportunity to find a stable job. And then link that through the factory with the designers that don't have work first to develop their brands and their ideas.
Wow.
So it's linking the need of a job with the need of exploiting, let's say, the creativity in my country. So hopefully my factory and the sewing school can help develop the design industry in Nicaragua.
I think that's excellent because, to be completely frank, without skills, without work, it doesn't much matter if you have health care because you're not going to be able to afford it, right?
Yeah.
That is an important consideration for sure. And this providing work is a tremendous start in that direction.
This communities I'm working with, I'm starting with a community that used to be a huge trash dump in the capital city.
Wow.
And all they know how to do is separate garbage, and like separating plastics and metals for recycling. They don't make much money out of that, and they have been relocated to different communities, and they have been assigned jobs once the trash dump was industrialized. The thing is that wherever you move them, all they can do is separate garbage.
still have only
So
that
they're
one
starting to bring the garbage to their new communities.
Oh my.
So we have like smaller, but few trash dumps.
Jeez.
So they really need a job.
Yeah, they really do need a job. There's so many in this world who do. I want to take a quick break, come back for just a moment or two, and talk just a little bit more about the program and what kind of the exchange itself, a little bit more with you as well. So we're going to take a quick break, come back with more with the Utah Council for Citizen Diplomacy right after this. Welcome back to the Mountain Morning Show, where we continue our conversation with Watson, Maribel, Maria, and Rochelle. This is incredible. The Utah Council for Citizen Diplomacy bringing the Young Leaders of America's initiative here again to Utah, and some great young people. How many all together, Rochelle, are visiting us right now?
10 in Utah.
10
but
in
I
Utah.
think the grand total was 250.
Wow, nationwide.
Nationwide.
It's so important because we've just barely scratched the surface here, and I really wish we could do this easily for an hour and talk about each one of these fine individuals and the work that you're all doing, which I think is just tremendous. But I wanted just for a moment, because we only have just a moment or two to talk, to tell, when you look at what you want this world to look like going forward, especially where you're from Haiti, what do you hope? What are your hopes?
I hope in Haiti that people will have a chance to get access to healthcare, because in Haiti we have a lot of health disparities.
Yeah.
So people who live in countryside, they don't get access to healthcare, to insurance coverage plan. They don't. They are facing every day. So the spreading of epidemic diseases such as cholera.
Things that we could solve if we just had basic care.
Yeah, basic care. So waterborne disease, vector-borne disease, a lot like malaria fever, typhoid fever. So I think that we could change. We can change the situation if we start to educate them. If you go in rural communities to provide the basic care that the people need, because in Haiti we have around 40% of the population who lives in countryside or in rural communities.
Yeah, and we're talking real countryside. It's not. It's
yeah, we target the whole
inaccessible
countryside
places. Some of them pretty rough.
Yeah. So my project is about community healthcare. It's not only dentistry, because we provide like cleaning, restorative treatment, extractions. We provide primary medical care, high care to those people. And sometimes we give them some affordable glasses because they need that, reading glasses.
Wow.
So
that's a real basic need.
Yeah.
Just to be able to read.
Yes.
Wow.
So because those people need to walk like 4 or 5 hours to go to in a hospital. So they can go by motorcycle. They can take 5 or 2 hours. So it's a very big issue. So
anything to them is a journey, and a journey just to get basic needs.
Basic needs.
Wow.
So,
Watson, that's amazing. I really want you to have that. I've been there. I know what it's like on the ground there, and it sounds like a lot hasn't changed, but at the same time, some has, because we've got good guys like you working there.
Thank you
for that. That's awesome. All right, I turn our attention to Maribel for a moment. So Bolivia, what are your hopes that you can? What do you hope that you can see in the future in Bolivia, especially from this project?
Now in my country there are a lot of people that don't have a place to go. They are terminally person.
Do you think that we're in a position where in the future you'll have large hospice facilities? Is that what you're hoping?
Yes, I think, because my experience here teach me that it's possible. The place where I am, at the beginning they don't have a lot of facilities, but they get what they want. They get to open a hospice here, no? And when I realized that the economical area is not too important. The important is the work that we do every day. If we work for a big goal every day, with all our heart, with all our passion, we can get that goal. So I'm sure that in Bolivia we can open a big place for these people. We are going to help to the government to solve this problem, because we don't want people dying on the streets.
No, you don't. You want people's last moments to be hopefully reflecting on a decent life.
Yeah.
Right? At the very minimum.
Yeah.
I'd like them to have a happy life.
Yes, they deserve that. All
I
of
think
us deserve.
I think so too. Wow, that's excellent. Well, you know, I get back to that without some work and without purpose, there isn't much of a happy life out there. So that's, I'm assuming, partly what you're expecting out of all of this.
Yeah. Well, as I said, my project goes way beyond fashion design.
Yeah, it really
clothes.
does. It's the basics again, isn't it? It really is.
It is the basics. So, okay, well, the community I started working with, it used to be a huge trash dump in the main city, in Managua, the capital.
Yeah.
And it was industrialized, so now it was split into different smaller communities,
Right.
and most of the people were assigned with houses. The problem is that all they know how to do is separate garbage.
But now, one of the things we've talked about, I want to kind of wrap up with this notion, is that at the minimum, at least thankfully, they've learned to read, right?
Yeah.
Because we kind of got back to this is such a critical part here.
Yeah.
So your ability to go in and teach them some skills is viable.
It is. We still have to, I mean, the project, the course includes technical, but also it has a psychological side behind it.
Yeah.
Yeah, because even though most of them know, I mean, they have to know how to read in order to get the course, right? Because we don't teach them how to read. So it's good that most of them know how to read, even kids. I mean, young people. But there's a psychological side to it behind, which
it's what they've only known.
Exactly.
Is that right?
It's to teach them that there's a society and there is a reality behind all they know, which is like a garbage. It sounds sad, but it really is. When you go and start working with them, you realize that there's so much joy and happiness in them. And it's so it's a huge contrast to get to see how happy they can be, not having like nearly anything.
Well, it's a dream, isn't it, for them? This is really dream fulfilled.
Yeah.
Right?
Yeah.
Wow. I really want to talk so much longer. Rochelle, I have to leave you with the last word here. What do you think about all of this? I mean, you're really where you see this every day. These great people that we bring here, and hopefully they get an opportunity to really take something home that's helpful.
Right, definitely. My hope is that this program continues for many, many years, and that they expand it, because it's only 10 of them. Imagine if
once a year.
Once a year, exactly.
We really should be doing this every week. Shouldn't we?
Like semi-annual, but yeah, every week.
You don't want to get that busy that fast?
Yes. So that would be my hope, and I was so lucky and fortunate to have them here in Utah.
We certainly are. No, thank you to the work the Utah Council for Citizen Diplomacy does. You should get involved in that work too. And really, it's not hard. All you have to do is actually show up at their events. That's the place to start with that. Many opportunities to volunteer, certainly many to just listen to the messages of people throughout the world who have great need, but also are providing great service. Much more to come here on the Mountain Morning Show, and we'll be right back.